Welcome to the webinar, everyone. We're so excited to have you here today, and we're excited to get started. On behalf of Lakewood University, my name is Tanya Hagans. We have a powerful presentation today featuring Dr. Patrick Nuzzo and the Southwest University of Naturopathic Medicine. I'm happy to announce our alliance with Lakewood University and Southwest University of Naturopathic Medicine. And without further ado, we're going to go ahead and get started. I'm going to turn it over to Dr. Patrick Nuzzo. Thank you so much for coming and being able to present this amazing information.
Very good, very good. Well, thank you, Tanya. Thank you very much. And welcome, everybody. We're really honored to have you here today, brought together by Lakewood University and Southwest University of Naturopathic Medicine. Today, we'll explore chronic inflammation. The root of so many modern conditions can actually be addressed through evidence-based nutritional strategies. And that's what we're going to be talking about today. We're going to be talking about food as medicine. We're going to be talking about anti-inflammatory medicine. We're going to be talking about disrupting healthcare. Whether you're here for yourself, your patients, or your career, you are definitely in the right place, and we're really happy to have you here. What if the most overlooked medicine wasn't in a pill? What if it was on your plate? We use medicine and pharmaceutical medicine to cover up all of the symptoms that people have when experiencing chronic inflammation or any of the myriad of deficiencies and conditions that nutritional deficiencies will create and cause. Nutrition is just not a complement in your regimen, in your food regime. It's actually a core strategy. And that's what we're going to be teaching you here as well. Chronic inflammation is at the root of nearly every major health concern today. Autoimmune disease, joint pain, back pain, arthritis, you name it, inflammation is at the root cause. And as naturopaths, okay, and we'll talk a little bit about what naturopathic medicine is, and as anti-inflammatory nutritionists, we work to go at the cause of these conditions, the cause of inflammation. We go about it metabolically, food is medicine, nutritional strategies. We go about it manually with hands-on manual therapy as a doctor of naturopathic medicine. So we are really looking at the root cause of disease and how to treat it and how to go about it in this program. Who is this webinar for? This is for health professionals, doctors, naturopaths, chiropractors, nutritionists, nurses, okay? And also for everyday people passionate about their own health. You really have to be able to utilize and take care of yourself in order to take care of other people. We will teach the ways and the strategies to learn how to utilize food and how to use supplementation to treat inflammation, which creates all these different maladies in the population today. You know, we have a chronic disease epidemic in the United States. Almost 80% of the population is in chronic disease. Huge numbers of diabetes and heart disease and cancer. And these are all areas that can be treated by utilizing whole food supplementation, great diets, utilizing strategies to rebuild systems that are broken down from chronic inflammation. Who is this webinar not for? You know, we're going to be honest about this, okay? It's not for those looking for shortcuts. If you're willing to apply what you've learned on your own life, okay, or you prefer surface level education, this program isn't the right fit for you. We go deep and we expect our students to engage with integrity and passion in what we have. So you've got to take this on and become a model, become a, example of health, and that's what happens with people. People find something that makes them feel better and they really start to move into it and they get involved with the program and they get involved with their own healthcare. We have to try to shift the health burden from prescription medication to self-care and utilization of really long-term strategies to rebuild lifestyle, regenerative lifestyle, rejuvenative lifestyle. We'll talk about all that in this program. These are the requirements that you're going to need to get your Master of Science in Anti-Inflammatory Nutrition. You're going to need to complete a bachelor's degree in an appropriately accredited institution. So an institution that's accredited by an accreditor recognized by the U.S. Department of Education. And you're going to need a GPA average of 2.5 on a 4 scale from that accrediting institution. So those are the things that are necessary to get into the program. No other prerequisites, just that bachelor's degree. And a passion to want to be able to come into this field. And that's really what we want to talk about now. Their passion, purpose, persistence, right? You have to have these things in order to move into an area that you want to help change your own life and change other people's lives. Passion is, just at the root of everybody's meaning. You got to find a meaning in life, and passion and purpose will bring you to that. Imagine the shift from feeling confused, burnt out by symptoms and prescription medications to having clarity and tools that actually work for yourself and for looking at other patients and friends and other veterans. From generic protocols to personalized science-backed strategies. This program leads you through that transformation, and we have case studies that we work with that can prove that these nutritional strategies work in your life and they will work in other people's lives. The nutrition and the science is there, and this is all based on science and cutting edge therapies that are here and now that people are working with. All right, stay around. At the end of the seminar, we're going to be offering a free anti-inflammatory starter kit. And it's just kind of a guideline in what you want to do, what foods you probably should start looking to stay away from, what foods you should start adding in your diet, and really the quality of the foods that you're putting in yourself. So please stick around. If you have questions, there'll be time to do that at the end. We're really looking forward to getting into this now. So who am I? I've been sitting here talking for a few minutes now and talked a little bit about naturopathic medicine and talked about anti-inflammatory medicine. What is naturopathic medicine? Okay, naturopathic medicine started right alongside chiropractic medicine, in the early 1900s. The founder of chiropractic medicine, D.D. Palmer, brought a protege in named Oakley Smith. Oakley Smith was the founder of naturopathic medicine. So the philosophies and the education of both sciences and both professions are very, very linked. The nerve flow principle, anti-inflammatory concepts. The difference between naturopathic and chiropractors is the way naturopaths treat and what they treat. Naturopaths are connective tissue specialists that focus on the connective tissue to bring bony alignment instead of high velocity adjustment. Further, that's the manual side of naturopathic medicine. The metabolic side of naturopathic medicine is the food as medicine concept. We are licensed and regulated by the medical board in the state of New Mexico as connective tissue specialists. And in our scope of practice is these manual therapies. And we are developing that side of the manual therapy to be able to outreach, especially to veterans, okay? We have a vision of veterans healing veterans. And veterans healing veterans is a way for us to reach out to the veterans population because the GI Bill will cover both the Master of Science in Anti-Inflammatory Nutrition degree and the Doctor of Naturopathy degree. So they will cover this education. And our vision and our passion is to see this medicine help treat other veterans and get those veterans to work into the VA system. We want to educate veterans, help them with their health, help them with their inflammation, and then get them to get back out into the VA system and practice and work with other veterans, healing them. Okay, so that's a real big passion and a drive, and our strategic plan to move naturopathic medicine, anti-inflammatory medicine nationwide. The healthcare system in the VA is very, very large, okay, but it's very targeted and very focused. And we want to see our practitioners start to disrupt veterans' healthcare with health by bringing these strategies, by bringing these doctors, by bringing these lifestyle nutritionists towards the VA system. And I really feel that this is going to work. You know, the other things that I've done, I've gotten the naturopathic profession licensed and regulated in New Mexico. I was involved when it first got licensed in Illinois. And then just 2 years ago, we got ourselves licensed and regulated in the state of Nevada, where naturopaths can now practice there as doctors of naturopathic medicine. But this passion that we have for working with veterans and seeing healthcare move throughout this country, you know, and utilizing the VA as our target audience to be able to try and do the studies, do the research that will prove our theories and our professions and bring this out to the masses. Dr. Joe Fraley. Joseph Fraley is a chiropractor and a naturopath. And Dr. Fraley will be the lead instructor, and he's the actually head program director of our Master of Science in Anti-Inflammatory Nutrition degree. Dr. Fraley is a clinical nutritionist. He practices nutrition in his clinic down in Rio Doso, New Mexico. He's been at it for more than 20 years. He came from a family of chiropractors. His grandfather was a chiropractor. He came through the naturopath program about 2 years ago because he saw that you can't just keep adjusting the bony structure, you know, without treating the connective tissue that pulls that bony structure out of alignment. But his practice and his clinic down in Rio Doso is highly focused on the nutritional strategies. And Dr. Fraley, along with my staff here, wrote this anti-inflammatory medicine degree. And we're just really, really proud to have Dr. Fraley on board. Let's dig down into the facts a little bit here. You know, I keep on talking about the veterans, and the veterans are a very, very obviously large population. And there's been a lot of, you know, talk about how do we help improve veterans' health care. And there have been a lot of initiatives out there over the last decade of adding some integrative and alternative therapies to veterans' health care. And that's starting to happen around the country. But in December of 2023, the American Journal of Clinical Nutrition published a study that they worked on for several years, and they studied 1 million American veterans. And they took the 8 lifestyle factors that had impact on mortality and life expectancy, things like stress, eating habits, drinking habits, exercise, okay? These were all measured in this study. And by the way, these 8 lifestyle factors are the core element of our anti-inflammatory nutrition program. I wish we could take credit for writing this study, but we can take credit or take use of this study to share that this medicine is going to treat people at their core, at their cause, and work on lifestyle changes. And that's why we want to see Master of Science and Anti-Inflammatory Nutritionists become lifestyle coaches within the VA system so we can start changing healthcare there. But this Million Study Veterans program, it's something else that we could share with you. You could look it up. Published in December of 23, it just really shows that what we're doing is right on the cutting edge. And they're seeing that if we can get the veterans to take these lifestyle factors on, it will improve their health, it will improve their length of mortality in life. So I recommend that you kind of take a look at that. You know, we've got a couple of doctors, young doctors who have come out of the program. This is a Dr. Alicia Martinez, and she's gone through the master's degree program, is still in the master's degree program. And the way we teach it, you're able to not only start helping yourself, but you can start helping your patients, your loved ones, your family, because it is a step-by-step program that kind of takes you through conditions in life. And as you learn about how to take care of the body metabolically, you can start applying that to your own situations or to those of your family or your patients if you're already a practitioner. We have another young lady, two ladies actually came through the program together, and they work together at a clinic in Albuquerque right now. And they're doing hands-on manual therapies and they're doing metabolic therapies. It's a lifestyle approach to healthcare. And she says here, this is the tool she needed to elevate her practice. So she was, working with people nutritionally, but to have these nutrition strategies and to use them on yourself and to work with others and see the changes is just a really wonderful thing. What's the 40,000-foot view here? Okay. Really, this whole program is about taking on inflammation. Inflammation is a part of everybody's daily lives. If you have joint pain, if you get headaches, if you are suffering from diabetes, if you are having heart condition problems, inflammation is at the root cause of all those problems. So if you have arthritis, instead of taking anti-inflammatory medications and arthritic medications and painkillers, let's look at the root cause of what creates arthritis. And that's an acidic body, an acidic bloodstream. And the more acidic the body and bloodstreams become, the more inflammation that happens. It attaches to the joints start to disintegrate, the joints start to inflame, they become hot, they become irritated, and that's what arthritis is. It's a chronic, degenerative, inflammatory condition. We go in and start looking at what we need to do to put the fire out in the body. What do we need to do to get the gut back working, to get the body to digest, to get the body to eliminate, okay, to get the body to function the way it wants to function and it should function. And this is a pathway. This doesn't happen overnight. You got to take on a lifestyle, and you will learn a lifestyle by doing this. And this is our whole point. We want to change the way people think about food, the way people think about what they're going to put on their plates, about what they're going to buy, and really understand that food is medicine. We're going to teach that pharmaceutical medications don't cure disease. Pharmaceutical medication doesn't cure arthritis. It doesn't cure heart disease. It doesn't cure cancer. It treats the symptoms that those diseases bring on. We're going to show you how to go about building those systems that are broken down and inflamed because of these chronic inflammatory conditions and the way we're eating and the highly processed foods we're eating and the lack of nutrition that is in the foods that we're buying and in the food chain. And we're going to direct you towards how to shop properly and what foods to look for, and food is medicine. I keep on saying it, but we'll teach you that you can find foods that are grown in restored, regenerative soils that have nutrient value left in them. You can find animals that are humanely raised, that are fed with soils and foods that are grown on restored, regenerative soils. So it's the health of the family. It's the health of the animals. It's the health of the soil. We're really trying to rejuvenate and regenerate. I think you get my passion, guys. All right. The 5 biggest mistakes in healing inflammation, right? Again, focusing on the symptom. They don't even, look at chronic disease or identify the chronic disease. They just look at putting out the fire by tricking the system, by putting some medication in, not making the system work better, okay? Ignoring the gut inflammation and the gut microbiome. We've got to be able to get our gut working properly so it will digest the foods. It will process the foods. It will eliminate the foods. If people go on antibiotics, which is a really normal course of treatment in medicine, you start to knock the microbiome out of the digestive system. You'll hear now that people should be taking probiotics after taking a round of anti-inflammatories. or antibiotics, I should say. So we've got to look at gut inflammation, okay? The over-reliance on restrictive diets with no sustainability. That's what we're talking about with food as medicine. We will guide you to the sources. You got to buy, especially your staples, okay? You got to buy food sources that are organic, grown in regenerative foods that have nutritional sustenance in them, that will build the body towards health and build the body towards rejuvenation. And if we're buying the foods that are grown on regenerative, rejuvenative soils that are organically grown, we're also healing the soil. There's studies out there that show, and you'll get into this as well, that back in the 40s and 50s, that our topsoil has lost more than, back then, 60% of its nutrient value. Now in the 90s, the last study, that the nutrients that are in the soils are gone by over 90%. So if you're eating foods, vegetables, fruits, grown on soils that don't have nutrient value, you're not getting the nutrients in your body to heal the body and to make the body work with function. And then if you're adding, highly processed fast foods in your diet, you could see why we're running towards 80% of chronic disease in this country. Underestimating nutrient testing and lab data. That's really where we're going, guys. You go into a doctor's office, they'll give you tests to see if you're already in disease, right? They'll give you optimal ranges, the blood tests will show you, and they don't start treating until you're sick, okay? There's lab testing and nutrient testing out there to show if the body is getting healthy. We're going in the direction of health, taking people towards health by rebuilding systems. And the other thing that we do here is, we really work to educate our practitioners, not only how to do this to themselves, but to how to build a practice and how to treat individuals, veterans, patients, and work towards a healthier, more regenerative lifestyle. Okay, inflammation isn't just a symptom, it's a system-wide alarm. Okay, that's a really good line. We've been talking about that. Yes, I have inflammation. Okay, but is inflammation acute? And by the way, inflammation is absolutely a necessary part of our health, because if we hurt ourselves, if we sprain a bone or we break a bone, inflammation comes up and brings antibodies and brings blood and brings lymph to heal and to help. But then it should, as the body heals, the inflammation should go down. Well, inflammation in chronic and degenerative disease is a system that goes on and on and on without the proper fuels. And the system continues to break down, and it continues to use its own tissue and its own supply, and that creates inflammation. Okay. And these are some of the courses that we will be teaching that support these concepts. Okay. Biochemistry concepts of nutrition, pathology for the nutrition professional, diagnostic lab interpretation. But these are going to be on the labs that we're going to be looking at that will rebuild health, not to look at, oh, you have sickness and here's a medication that you're going to get because the system is broke down. This is all about rejuvenation. Whole food nutrition, properly applied, can reverse lifestyle diseases. Absolutely 100% true. It's people we have are living examples of it. I'll share my story. I have been a naturopath for 42 years. Okay. My uncle was a naturopath. Okay. So when I was a kid, if I didn't feel good, I was wanting to go and see my uncle for treatments, but he would always tell me what to eat, what not to eat, what herbs to take, what supplements to take. So I feel really blessed, at the age of, I'll be 72 years old this year. Okay. And I'm not on any pharmaceutical medications. I'm really, really healthy. I work from morning to night. I have, abundant energy. I have passion for what I do, and I attribute it to my lifestyle, right? And this lifestyle and this experience is embedded into these classes. So, Dr. Fraley, myself, we've had a lot of people who live this lifestyle and walk down this path. They're involved in this program. Okay. Supporting courses for, this is, food is medicine. Okay. Supplements to enhance health. We look at detoxification methods and how do we detoxify some of those organ systems to rebuild them. And then nutrition across the lifespan. What is good for children? What is good for adolescents? What is good for teenagers? What is good for the 20 somethings? What is good for 40 and 50 and 60 something women who really go through life changes and all they have is medication, supplementation, medication. We work to help them build their bodies so they can transition through these life changes with nutritional, metabolic, nutritional strategy support. You can build a really great science based career on this by taking your own health and elevating your health and learning how to do it and sharing it with your family and sharing it with other veterans and building a practice on working with people. And we're working towards getting you to a placement within the VA system. We want lifestyle coaches in the VA system that can do this. And this will train us and teach us to do this, okay? Supporting courses, business practice for the anti-inflammatory nutrition professional. That's a big thing. In our naturopathic clinic here, we train our doctors how to go out and build a practice. You've got to be able to be a business person to build a practice, or there's many places you can go and work within other clinics. But in case you want to start your own practice, in case you want to be in your own business, this could be for you. Okay. You've got to do a capstone program or a project within this master's degree. And that is a really exciting thing because, we are going to be doing cutting edge research that can be published. This area needs publication right now. We have a new wave of scientists coming out and science papers coming out, and we're going to be a part of that growing science in anti-inflammatory lifestyle nutrition. All right, let's look in the future here a little bit. I gave a lot of information for you to kind of ponder and feel and look at. But, imagine taking care of yourself, eating better, changing your diet to a restorative, regenerative, sustainable diet. Imagine one day, walking in your office, and picking up some lab results that are showing people how much better they're getting and showing your clients how much better they're getting because they're following the expert advice that you're giving them. It can transform your life. It can transform, practitioners' lives, like Dr. Martinez and, Dr. Harris talked about. They are working on themselves, getting healthier, working on patients, helping them get healthier. So please, take a look at this. Seriously consider this. We want passionate people who really want to make a difference in the world and change the way healthcare is, change the way healthcare is delivered, and change your own health because of it. I think we're going to turn it over to our admissions people.
Thank you so much for that, Patrick. That was an amazing presentation. Number one, thank you so much for the passion that you have for this career field. Thank you for presenting it in such a clear manner that everyone can understand. Just listening to this message now makes me want to enroll in this program myself. I mean, because inflammation is such a troublesome area in our society. And the way I see it is now it's really time for people to make a decision. They can book a call with an admissions representative about the master's program in anti-inflammatory nutrition, and to see if it's right for you. And basically, what happens on a call, there are no high pressured calls here. We want to make sure, as Dr. Patrick Newzel has indicated, that this is something that you want to do. That's something that you're interested in helping others. And if you're a veteran, as I am a veteran, wanting to help other vets out, we're going to just have a brief phone call with you to review your background and your goals. You can schedule a call. We'll help you understand the program fit and the timeline for completing the program. We're going to answer all questions about tuition, the curriculum, any scheduled questions you have, and there's no pressure. We just want to clarify any questions that you may have because really we're all adults and we make adult decisions. And you know, if this is something that you have a passion for deep down inside, you've always felt that we should focus on not the symptoms, but the causes. And so I think this is a perfect time for you to now schedule your Master's of Inflammatory Medicine. I'm going to put this in the chat here. If you can see it in the chat, just let me know. I'm going to just copy and paste all of this information along with the phone number. So there is someone to answer your calls. And that's the one thing we pride ourselves on is to be able to have someone to answer the calls Monday through Friday, 9 a.m. to 5 p.m. But you can schedule an appointment at any time. So I just put that in the chat for everyone to see. If you have any questions whatsoever, after the webinar, we're here to help you. You can learn about enrolling in the Masters of Science in Anti-Inflammatory Nutrition, and we call it MSANE for short here. We have a lot of acronyms here, but we're talking about the same program. Our phone number is 866-711-6179, or you can schedule a one-on-one appointment, and there's a Calendly link right there. We don't want you to wait because classes begin soon. We only have one start date available for the next month, and those classes fill up very quickly. So you want to make sure that you enroll as soon as possible because if this is the way that you want to go, you want to start right now. The great thing is that you don't have to wait for the next semester. We have classes beginning next month. So we look forward to having you in the class. And once again, that information is in the chat. And if you can go ahead and go to the next slide, please. I just would really like to say this to you more than anything. You were meant to change lives. You were meant to do something bigger than just yourself. And this is an opportunity to be able to affect not only your own personal life, that of your friends and your family, but people all around the world. Other veterans, other people who have been suffering, just taking tons of medication. And now is the opportunity that you have to be able to help them. Even in the health profession, even if you're currently in the health profession, you know, nutrition is not highly emphasized, even in your training that you may have had in the past. This is an opportunity for you now to focus on what most people don't do. So you'll be focusing on just what 5% maybe focus on, and you'll be able to really change other people's lives. And let this be your next step. Let us be able to help you make that next step if this is your desire. Next slide, please. And we just want to really thank you for your time and attention. I think I can speak for myself and Dr. Patrick Nuzzo. We do this
Thank you.
because we have a passion to help other people get from point A to point B, even in education. Dr. Patrick Nuzzo probably didn't tell you he is a pioneer in this field and has made this field available through much of his advocacy, getting statutes passed, legislation passed in order for us to have this program that's available to you now. So we look forward to you. On the next slide, please, you'll find the toll-free number. You'll speak with Miss Queen Love. She is the admissions advisor who can help you answer any questions you have. But once again, you can give us a call at this number, 866-711-6179. And then also in the chat, there is the appointment link for Calendly. We thank you so much for your time and attention. Dr. Nuzzo, do you want to say anything in closing?
Actually, I just, again, I mean, this is a really, privilege to be able to speak to your group of students and graduates, and I'm just honored to be able to spread this word. This word, I want to say join the movement. Disrupt healthcare with health. That's our mission. We want to get it out there, and with the expertise of Lakewood University and their great admissions team, I'm just really, 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 really happy to be able to be part of this whole thing. So thank you.
We do have a couple of questions, and I will read them to your hearing, and you
Okay.
can go ahead and answer the questions. Those of you who have any questions, please feel free to put them in the Q&A box, and we'll be able to respond to those. The first question we have is this program covered by the GI Bill?
Yeah, yes, it is. The GI Bill will cover this program. It was approved last September. We got financial aid approved, and these are some of the first classes that are be coming through with the GI Bill. So yes,
Eh,
absolutely.
Thank you so much for that. That's amazing. Another question is it a long process for registration for the GI Bill students?
I
No, if
can answer that question. I am Queen Love. I am a senior school certified official for the VA. And to answer that question, the process isn't long. Once you have gone through the admissions process and been approved after verification of your benefits, the process from there is very seamless. You're awaiting your start date and you'll begin your program.
and someone else asked, Miss Love, what is the process once I speak with admissions?
Once you speak with admissions and we have established your goal, during that call, we will verify your benefits with VA. Make sure that your benefits are eligible to cover the cost of the program so that there's no out of pocket to you. And then you will complete your admissions, which is your enrollment agreement, which will come to you via email. And then once you've completed your enrollment agreement, you are not considered a student until you have signed off on your enrollment agreement and completed the admissions process. After that is completed, then your enrollment is certified on your start date. Once it's certified with the VA, correspondence will be coming to you from the VA, which in some cases you may have to self-certify each month, but you'll get those directions once you are certified as a full-time student in the program.
Another question I see, will I have to attend in person at any point for this training?
No, this program is 100% online. There is some meetings of students. The faculty will sometimes call a meeting where you'll participate, but there is no travel with this. Your expectation of doing the classes online. We're on a quarter system here, and classes work really well. We've put together just a really fine curriculum and a lot of support material that goes along with each class. So it's work. There's no question about it, but you're working on yourself. You're working on your own health. You're working on, understanding and feeling better as you're doing it. So, that's one of the biggest comments that we get. People come through the program, how much more energy they're feeling, how much better they're feeling to be able to, accomplish this great goal for themselves. So, yeah, don't have
That's
to show up. You just have to show up and finish the classes and bring your knowledge and your passion to the webinars and to the into the chats with other students, and just get out there and start healing the world.
that's awesome. The next question I think I have is what makes this different from any other nutrition program?
Well, we're treating the cause. I mean, that's basically where we're going. This whole program looks at what caused this, not I'm going to give you something to take care of the symptoms or the pain that you're feeling because of this, or you're belching and you can't keep anything down. So here's some antacid medication. No, we treat the cause. Why are we not digesting? Why are we producing so much acid? Why are we getting headaches? Not cover them up.
Oh,
Dr.
wow.
Fraley likes to, I really love this. He says, we don't put a band-aid over a check engine light, right? We want to see what's on fire and find out the cause of what's on fire and go after it.
That's amazing. To follow up on that question, we have another question that says, what does it mean to treat cause, not symptoms?
That's a good question. You get a headache, okay, and you get chronic headaches. What is causing your body to get those headaches every day? Is it the way you're sitting? Is it the way you're sleeping? Is it the tension you're under, right? So you've got to be able to look, instead of just giving, here's some Excedrin, here's some migraine medication, right? headaches are one of the easiest things to treat and reverse in this practice. Okay. Simply by hydrating. Okay. People have to drink water in order for their body to work, right? So our tissue is made up of almost 84% water. And if you take a sponge and you wet it and you put it on the sink and you go back tomorrow, what's that sponge look like? That sponge is hard and crusty, right? So if our neck and shoulders dry out like that because we're under stress, we're under tension, we're not drinking, we're sitting at a computer all day long, the blood flow from the head down is going to be impeded like you're stepping on a garden hose, right? So we hydrate the body. We give the body fluids. We get them to move. We get them to exercise. We get them to stretch. It's all about lifestyle and magic. Headaches go away, and headaches are not a shortage of Excedrin. It's not a symptom of a shortage of, migraine medication, right? It is caused by a number of factors that we have to address and reverse to get rid of the headache.
That's amazing. I wish I would have found you many years ago, in my 20s.
Yeah.
Can you explain? The next question says, please explain how inflammation is good and how it's bad.
Okay, well, we touched on this a little bit. I'll do it again. See, the inflammatory response is part of our body's mechanism to heal itself, right? And I'll use, we sprained an ankle, okay? We sprained an ankle. The ankle is in pain. It starts to swell, and that's because the body is throwing antibodies, throwing blood, throwing lymph, throwing all of its, metabolic processes to go and attack and get that ankle healed, right? So that process for an acute condition is absolutely necessary, right? When, inflammation, when we have, allergens coming at us, right? People have, the body comes up, it produces histamines, it works against the allergens, right? So you've got to be able to work with that. So if those allergies, okay, if we're eating foods that aren't supporting that system and we get more allergies and more allergens coming at us, we get more inflammation. Those allergies turn into, sinusitis. They turn into, bronchial problems. They turn into infections, sinus infections, because we're not giving the body enough or treating those symptoms enough to go after the cause. So we've got to get hydration. We've got to get supplementation that builds the immune system up to try and fight that inflammation off. So the inflammatory response goes bad when we're continually getting an irritant towards us, whether it's stress, whether it's food, whether it's, allergens coming at us. Okay, if we get an overload of those and our body's not getting enough support to take care of that, and we're taking medication to suppress those symptoms, the inflammation goes from acute to chronic to degenerative, right? And the fire keeps on burning and burning and burning. So we want to get that body to start to heal itself again. Give it the support, give it the nutrients, give it the blood supply, the lymph supply, by stretching, by opening the body up, by, doing, some manipulation. So there's all kinds of ways to treat the body's cause, to get the inflammation to just do its job and go back home, right? It comes on fire, the fire goes out. But when we get to chronic, the fire is always there. And the more irritants that we put on top of it, the more the fire builds. So I hope that answered the question.
Yes, that answered the question. I think this is the last question. Oh, well, no, there's two more. One is, don't we want to get out of symptoms?
Absolutely, you want to get out of symptoms. But how are you going to get out of your symptoms? By just covering them up? That's not getting out of symptoms. You got to treat the cause and stop the symptoms, not cover them up. Like if you clean your house up, right? and you go and do this really good job of cleaning your house, and then you lift up the rug and you sweep it under, and that's not a real good concept of taking care of the mess in your house, right? You got a mess in your house. If you're getting symptoms, you've got a mess that you've got to clean up. Do you want to cover it up, or do you want to cure it? Do you want to go after the cause? So, good question.
Okay, and I think this is the last one. Someone asked, what kind of diet is best to follow?
That's my favorite question to answer, right? I it's about quality. I don't care if you're a vegetarian, a pescatarian, a carnivore, a fruitarian. Your job is to buy the highest quality food that you could possibly find and put it in your body, because that food is going to be what heals your body. That food is going to give you what you need to function and function at a high level. So your job is to find sources locally, regenerative, restored, organic. I mean, and it's everywhere now. 50 years ago, when I started in this process, I became a clinical nutritionist 50 years ago. There was the only way you can get food was going to a health food store, right? You had to go to a health food store, and I was living in Chicago at the time. I had to drive like 20 miles to get to the health food store that sold organic produce and stuff. Now, I don't care where you go. It's all there. You go in any supermarket in the United States and you'll find organic produce, and you'll find organic products, and you'll find products, not as good as the products as you'd find in health food stores. And I mean, you could really quality, 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 but it's not hidden anymore. The truth is out. People understand. So your diet should be made up, especially the staple foods that you live on, the highest quality foods that you can possibly source, and be eating those as your diet.
Wow, this has been so informative, and I can see your passion coming out about this, Dr. Nuzzo. Thank you so much for that. And being exposed to this information has been life-changing in just a short period of time that we've been doing this webinar together, just learning all these concepts and how powerful this program can be for individuals wanting to change not only their life, but other people's life. And they're going to learn all of that. And we do have a guide for anyone. Dr. Nuzzo promised a guide for any of you who want that guide at the end. If you could just type in your email address into the chat box, and we will make sure that you get a copy of the anti-inflammatory starter kit. We just need you to put your email address. Okay, I see several email addresses going up. Thank you so much. We'll get those out to you. And thank you for attending the webinar. If there's no further questions, Dr. Nuzzo, I'm going to leave it to you to end this amazing webinar.
All right. Thank you, everybody. Thank you. I hope that you'll think about this. I hope that you'll change your lifestyle. I wish you health. I wish you happiness. And this is a way of bringing that. Working on the body is so satisfactory. It's such I always tell people, it beats working for a living. I get to work with people all day long, treat people and talk with people. And, I'm privileged enough to be able to do that in my career. And I want to be able to bring a bunch of us along. So let's get out there. Let's help veterans heal. Veterans healing veterans should be something that should be known nationwide. Let's get this movement in there. Join it. Thank you so much, Tanya. You've done an incredible job here. You've been just a perfect host, and I look forward to working with you in a long future with Lakewood University.
Oh, same thing. I couldn't imagine the world without Southwest University of Naturopathic Medicine. So thank you again, everyone. Enjoy and have an amazing, amazing rest of your time.
And please give me a call.
Yes.
866-711-6179, or schedule your one-on-one with me to discuss how you qualify. I am looking forward to hearing from you all. Have a great day from Queen Love, your favorite SEO.
Have a great day, everyone.
All right. Be safe.
Be safe.